Hi there, our highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. This video I am about to present was compiled by Dr. Nath Arua, a clinical pharmacist by training and profession who is the founder of Progressive Pharmacotherapy Consultants, the premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management and optimal clinical outcomes are very crucial and non-negotiable to us. Here we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So, on behalf of the Institute, I humbly urge you all to sit back and spare me part of your very precious time to share with you very useful tips which may prove very, very handy in your line of duty. I now welcome you all to part 556 of our pharmacotherapy series, which majors in schizophrenia. After intensive education about her illness and need for treatment, as well as enlisting the help of her parents in ensuring she will take her medications, JPJ eventually agrees to take oral medications and is restabilized on risperidone 2 mg twice daily again. After discharge, her outpatient psychiatrist notes that JPJ is still responding to internal stimuli, and confirms she is still having some auditory hallucinations. JPJ's parents confirm she is taking her doses, so the dose is increased to 3 mg twice daily. Within a few weeks at her next appointment, JPJ's parents inform her psychiatrist that she can barely move, and she walks like an old lady at times. The psychiatrist examines JPJ and notes she has some mild stiffness in her extremities, a mild tremor in her hands, and when she walks her gait is abnormally short and almost shuffling in appearance. Her hallucinations have subsided, however. What is the probable cause of JPJ's abnormal neurologic findings at this time? What information in her presentation supports this finding? JPJ is most likely suffering from drug-induced Parkinsonism, a type of extrapyramidal symptoms. All the abnormal findings noted in JPJ at this time, stiffness, tremor, and shuffling gait, are characteristic findings for drug-induced Parkinsonism. Although risperidone, as an atypical antipsychotic, is less likely to cause this problem compared to the older, conventional antipsychotics, it can still cause it. One risk factor of Parkinsonism with risperidone is increasing the dose, which occurred in JPJ recently. Although she was fine on the lower dose, the increase in dose to 6 mg per day caused enough D2 receptor blockade in the nigrostriatal pathway to induce this extrapyramidal symptoms type. How can JPJ's drug-induced Parkinsonism be treated? Ideally, the first choice would be to decrease the dose of the offending agent. As JPJ's dose of risperidone was just increased to 6 mg per day due to lingering symptoms, this is most likely not an option, as it is highly likely those symptoms would return. A change in antipsychotics could also be considered, but it appears that other than the extrapyramidal symptoms, JPJ is currently stable on this medication and dose. The only other option would be to add another medication to treat her Parkinsonism. Some options include the use of anticholinergic medications, such as benztropine, or the use of amantadine. JPJ's drug-induced Parkinsonism resolves with the addition of benztropine 0.5 mg twice daily. Will JPJ need to stay on this medication indefinitely? JPJ should be maintained on benztropine for at least 3 months once her Parkinsonism resolves. If there are no other changes in her clinical status or her medication treatment for her schizophrenia, then the use of benztropine should be re-examined at that time. If the medication is then removed and her Parkinsonism does not return, then she should not need the medication any longer. Should the extrapyramidal syndrome return, however, then she may need continued anticholinergic treatment. So there you have it, our highly esteemed viewers and listeners. That brings us to the end of this video. If it benefited you in any way, kindly remember to give it a thumbs up, to like it and to share it widely with your peers. Please leave your comments at the bottom, and if you haven't yet done so, I humbly urge you to subscribe to our YouTube channel. I would like to promise you all that the very, very best is yet to come. Thank you very much for viewing this video. On behalf of our senior colleague, Dr. Nath Arua, I sincerely appreciate your partnership, continued support and kind collaboration. We look forward to interacting with you in the next video, which will be part 557.